Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, this is Di McQueen, and I am returning to our podcast, Healing Families Shattered by Addiction. You know, April is Alcohol Awareness Month, and so of course we want to highlight that. It is a very important, issue to be discussing. And so I figured I would kind of tackle that with you guys a little bit today and just kind of introduce what it is, why is it important, and just some basic stats and stuff about alcohol and how it relates to people in this country. So Alcohol Awareness Month is a public health program organized by the National Council on Alcoholism and Drug Dependence. And it's a way of doing outreach, it started, giving outreach and education back in the 1980s with the intention of helping college students realize like the dangers of drinking too much and also that they might be. So, the big part of alcohol awareness is to go ahead and point out the stigmas that still are associated with alcoholism and substance use disorder in general. A lot of people have a lot of denial around this, but also that, it can't possibly be me. And also it's not just the person that is involved with it, but it's, friends and family and people around that kind of, don't really want to believe that is something that might be happening inside of their home with one of their family members, with one of their loved ones. Alcohol Awareness Month is a wonderful opportunity to update your knowledge about alcohol use disorder, and the very impact it has on our health and society. Believe it or not, and I'm sure this stat has changed even in the last few years, but over 140,000 people die each year from alcohol misuse, making it one of the leading factors of preventable deaths. They can link alcohol misuse to over 200 diseases. And, I mean, that is mind blowing just in and of itself. We spend over $249 billion each year. And I go, and that's, for different things out, obviously automobile accidents, health issues, treatment centers, etc. Over and over again. The list just goes on and on. It has tremendous emotional and painful impacts on the families and loved ones of people who have issues with alcohol. So, I just wanted to kind of discuss a little bit of what that looks like. Guidelines for drinking in this country. So, for a lot of us, people don't even realize what legal limits are, what that even means, etc. So, from the 2020 to 2025 dietary guide for Americans, the stats for legal drinking, that's going to be something that will be non-effective to, causing you to be in moderation, or what we consider to be moderation, is 2 drinks or less a day for men and 1 drink a day or less for women. And that is, in fact, where we consider it to be quote unquote normal or manageable. When is moderation still too much, right? According to these same dietary guidelines, right? If you're taking medications that interact with alcohol, you need to really check yourself. Managing a medical condition that can be worsened by drinking alcohol under the age of 21, because of course our legal drinking age is 21 years of age. If you're recovering from an alcohol use disorder or substance use disorder, it is highly recommended that you don't go ahead and try drinking again. Obviously, if you are pregnant or might be pregnant, you probably want to abstain from the use of alcohol. The other thing that we like to point out for people with, that might be not really aware of, but for older people and certain individuals driving, operating machinery, etc., and participating in activities that require, specialized skill, coordination, and alertness, you probably should consider maybe not drinking alcohol, especially while you're in the midst of doing those jobs. If you're a iron worker standing on the top of a building, it's probably not a good idea to be, drinking and potentially losing your balance. So I think that's really important, where we start to recognize, like, okay, I have to use, what's important to me to understand, even though I may be able to drink, is it a good idea? Alcohol misuse, or we include binge drinking, heavy drinking. Obviously, that increases your, harmful consequences may be at the end of all of that. And it may be I lead myself into an alcohol use disorder. The more drinks in any given day, or the more alcohol that's misused over time, the greater the risk. So, the National Institute of Alcohol Abuse and Alcoholism defines binge drinking as a pattern of drinking that brings your blood alcohol content concentration, your BAC, which we call it, to 0.08% per deciliter or higher. For a typical adult, this would mean a pattern of corresponding to a man having more than 5 drinks and a woman having more than 4 drinks in a 2-hour period. So heavy drinking includes, for men, someone who drinks more than 4 drinks a day, or 14 drinks per week, and for women, 3 drinks in a day and 7 drinks per week. And people go like, why is it different for men than it is for women? Well, let's talk about that for just a moment. Women, typically women are much more likely to have susceptibility to a short-term, alcohol-related consequence, because they don't have as much, body mass, and they are less water. So we have a much greater risk to have health-related, health-related issues with alcohol problems, which would include liver, cardiovascular disease, neurotoxicity, and memory blackouts. And that's a much greater chance than men. And as I stated, most people don't realize that women's bodies don't have quite as much water as men's do. And then pound for pound, you have less area, right? So it starts to decay women's internal organs much faster than it does men, which is oftentimes why you see people or women who have been drinking for a period of time and you go like, wow, they look really weathered. It's because they are, and because their bodies are going, help, help. I've got problems over here. Anyway, so we want to make sure that women pay much closer attention to that, and realize that their bodies really do take a toll much quicker than men's do. Biological fact. So symptoms of alcohol use disorder. So maybe you're drinking and you don't realize that maybe there's some things that are going on and that you're starting to have, some signs that maybe, hey, I might be in trouble. These are the things that you might want to look at in the past year. Had times when you ended up drinking way more than you thought or longer than you intended. So, I'm going to go out and I'm going to have 2 drinks and I'm going to go home. But you don't, right? More than once you wanted to cut down and stop drinking, tried, but couldn't. So there's that where, you go out and again, I'm going to have 2 drinks when I go out and I end up having 4. I'm only going to drink on the weekends. I promise I'm going to do dry January, but I don't make it through January. So that's the kind of thing I'm talking about. Spending a lot of time drinking, being sick from drinking, or getting over the, after effects of a hangover. Wanted to drink so badly that you couldn't think of anything else. That would probably be a good indication that there might be a problem happening. Found that drinking or being sick from drinking often interfered with, things at home, taking care of, the projects you were supposed to do, or I have to stay in bed today. I don't really want to do anything. I'll lay around and watch TV. And I'm starting to have an effect with the way it interferes with my home life. May have caused job problems, may have caused school problems if you happen to be a college student or younger or older, but you can't make it to school the next day or you miss, your first period every day. Every Monday morning is a problem. Those are indicators that we might be getting into trouble with alcohol use disorder. Continue to drink even though it was causing problems with your family and friends. So family and friends have now mentioned to you, hey, we're a little concerned about you and we're seeing that you're doing things that are, making us feel uncomfortable. And you're like, yeah, okay, whatever. But most people, family members don't come to you and express a concern if there isn't a reason to. I suppose there's always that one in a couple million, but the chances of family and friends bringing it to your attention and there really not being a problem is kind of that doesn't really compute. So when a family member brings that to you or a good friend, you should maybe pay attention and go like, hey, I need to at least think about that. You've given up or cut back on the things that were so important to you or interests that you had, activities, things that used to give you pleasure in order to drink, or that all of your events have to be around an event that has drinking involved. More than once, you got into situations while drinking, that increased your chance of getting hurt. So maybe getting in a car and driving, swimming, using machinery equipment. I think we talked about that earlier, like doing risky things, going into dangerous areas, maybe having unsafe sex and waking up going, oh my God, what have I done? That type of thing. Continue to drink even though it was making you feel depressed and anxious or adding on to health problems. You've been to the doctor, they're telling you that you're having some issues and that it may be, due to alcohol. And they may not even know it because it depends on if you're telling the truth or not. But if you're starting to have health issues, especially with your major organs, there is a good chance that maybe there's something going on. Or after you've had, you realize that I'm starting to have blackouts. Like I have big gaps in my memory and I don't really know what that's from, even though the night before I was out drinking and I can't remember what I did. That's a really scary thought. had to drink much more than you once did to get the effect you want. So, in other words, we call that tolerance. You're building up a tolerance for these types of things. And, what used to be 2 drinks, I'd kind of catch a buzz. Now I can drink the bottle and it really doesn't seem to affect me. So, I think I've just got this great gullet that can handle this stuff. And, usually that's a very clear sign that there's something really wrong. I found out the usual number of drinks you had have a much less effect. So, like I said, we had a couple drinks, used to get us a little buzz. Now it takes the bottle, sometimes not even that. When now the effects of these alcohol, moments when I'm out drinking, when the alcohol wears off, I begin to start seeing withdrawals right away. Those are things like having trouble sleeping, shakiness, restlessness, nausea right away. And when I take a drink, it kind of goes away. That's a pretty good indicator that you're pretty far into an alcohol use problem. Sweating, racing heart, dysphoria, we call that, which is feeling uneasy or unhappy, like most of the time. A malaise, just a general sense of feeling unwell. Low, feeling very depressed. Seizures, that's a big one, right? Or there is that thing that you could even have a stroke. So it's really, really important if you are drinking a lot that you please, please do not just stop cold turkey, especially if have some years on you. Your body may not enjoy it quite as much as you think, right? And it can be extremely dangerous. The amount of deaths that are caused from people, trying to withdraw from alcohol is extremely, it can be very high and it can be very risky. So please, if you have this problem, please, 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 begging you to get some help. So consequences, right? What are some of the short and long-term consequences associated with this misuse, alcohol misuse? Fatalities and injuries. Alcohol-related deaths in the U.S. are increasing every year. We realize that there is about 30% of all suicides, 40% of all fatal burn injuries, and about 50% of fatal drownings and homicides come from alcohol. 65% of all fatal falls. 29% of all motor vehicles have some sort of motor vehicle fatalities, have some sort of involvement with alcohol. The amount of alcohol related emergency visits has increased 50%, in the last up until 2014. And then we know that there is now another increase since that time. So the statistics haven't been done in the last few years, but at that point, we're knowing from 2006 to 2014, it increased 50%. Those numbers are staggering and they continue to get worse. About 1/3 of injuries treated at trauma centers have some sort of alcohol related, misuse. And we also know that a great, great number, they don't have a specific statistic on the sexual assaults that happen, have alcohol and or drug misuse. Alcohol related blackouts are increasing and they occur and they are terrifying for people when they wake up and go like, oh my God, I have no idea where I came from, where, what happened over this period of time that I was not in my right mind. We also know that there is a heavy increase in, signs of dementia, health problems. There is a alcohol related dementia that, some people call it wet brain, but that's really sad, all self-induced, right? Where you could have gotten help and that doesn't have to happen. More health problems that occur, liver issues are a big one. We know that. Half of the liver disease deaths in the US are related to alcohol, 100% preventable. How sad is that? Other increasing things that go that way. We also know that there is a increase in breast cancer by quite a percentage if women start drinking early on. There's heart disease, there's esophageal cancers, all kinds of different cancers that work on the mouth and the throat and what have you, because, it's very acidic. Larynx, pharynx, liver cancer, colon cancer, rectum cancer, all kinds of, heart issues, kidney issues. And we also know that some people, engage in unsafe sex. So we have undue pregnancies, etc., that are related to that. Those are the kinds of things that we need to really understand about alcohol use disorder and how bad things can get. Not to mention how many arrests, how many people have broken up families, how many people are not able to hold a job, or getting into related issues with their workplace and amongst friends, um, you know just the cause of health issues. I mean, it's just a staggering number, as I told you before, $249 billion a year. So remember, these things are so important to understand that, most of these things I want you to learn, understand. The wonderful part of all of this is if you recognize that there is a problem and you want to do something about it, there is help available. Lots and lots of people are now specializing in how to help someone, get treated for and get into recovery. There's wonderful organizations like AA, other 12-step programs that are, able to help people that work through different genres. So we need to make sure that people understand that. There's some unconventional, something other than a 12-step program, but there's all kinds of there's things out there for people. There is help. People like myself and Dr. Jackson, family and addiction experts. There's many, many organizations out there, coaches that can help you. There's interventionists that can help with families. There's all kinds of help. And we encourage that people get that help. Once you make a decision, there are tools and techniques that can be given to people to help them through these, the first 6 months to a year, which is very difficult, and giving them tools and techniques, and then they can take it on from there. It's amazing when people do get help, how we see that families come back together. Children start talking to their parents again. Family members start, embracing this person and supporting them in their recovery process. It's also sometimes, for myself included, it was one of the greatest gifts ever given, because I realized there were issues that needed to be dealt with much deeper than the reasons why I was, using and abusing. So I think that that's the part that really matters, is that if you take advantage of what's out there and recognize that it is a predominantly, it is a huge problem in the US, and we promote, alcohol. And for the average Joe, that's great. For about 15 million to 20 million people in the US right now, it is a huge problem. And that's a pretty staggering number. And it affects you or your family or your loved ones. I would suggest that we try to see what we can do to gently and calmly and with love and affection let them know that we would really love for them to go get some help. Reach out to us. Family and addiction experts, we'd be happy to have a conversation with you, free of charge. There's many others out there that will do the same. We want you to be aware of, it's a very important topic. And, this month is highlighting, how we can help people with this problem. It's not, there's nothing wrong with having this issue, provided you do something about the issue, right? So having the disease of alcoholism or alcohol use disorder is not a, scarlet letter anymore, thank goodness. But it is something that you have full control over if you choose to do something about it. As Brian and I always say, it's like the only disease in the world that if you do what you're supposed to do, you can arrest it 100%. 100%. All right. So I'm Di McQueen. This is Healing Families Shattered by Addiction. I hope some of this was helpful for you. And anytime, we'd love to hear from you. We do have some information on our family survival kit. Feel free to visit our website, www.familyandaddictionexperts.com. And I hope you have a wonderful April and learn about alcoholism.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.